Thank you, member. Apologies for absence.
Perhaps for Senator Longmore might be either late or absent.
Duly noted. Any other apologies? All right. So that is Senator Longmore. As we welcome Member Daly. Yes. Next item on the agenda, welcome and opening remarks. I welcome you all as we resume our joint select committee sittings at a time when we mourn the passing of the Honorable Shahini Robinson. Minister Robinson was appointed and assigned to the Ministry of Labor and Social Security in 2016, and during this time she served with humility, distinction, and utmost integrity. She was fair and fearless and exerted great passion in the discharge of her duties. She was an advocate for the protection of workers and promoted the tripartite partnership in industrial relations in Jamaica. It was Shahini Robinson who tabled this occupational safety and health bill in the Parliament. And I'm sure she would have loved to see that this bill becomes law, and she would have wanted to see the implementation of this new law. She has left us, but her warm personality, love, and commitment to public service will always be remembered. Minister, yes, Member Daly, I recognize you. It is not your usual side, Member Daly.
Morning, Chairman, morning, members, and members of the technical teams. We on this side, and particularly myself, would like to pay a very special tribute to Minister Shahini Robinson, who has passed away this last week after fighting very hard her illness. Many people would not know, but Shahini and I go way back, long before she ever thought of getting involved in political representation. And it was at the same Ministry of Labor and in the same office where you now occupy at Hero Circle, where on many, many weeks in your same office, which was also the office I occupied as Minister of State, we would sit, have lunch, and talk about everything that we experience in Jamaica. From then I realized how deeply committed she was to people and ordinary people. And when she decided to take the plunge in political representation, in fact, even though I worked for demise in that by-election, I encouraged her to run. We represented both different political sides, and many of us in this room were engaged in those by-elections in St. Anne, and she was victorious. I didn't get to see her the night of her victory, But the day after we spoke, and I commended her and congratulated her. Shahini was a quiet warrior, one who was very soft-spoken, and on very rare occasions you would ever hear her lift her voice. Deep down in her was this passion and love for the Jamaican people, for the people of St. Ann, the people of her constituency. And she got to love the Ministry of Labor and Social Security. Of course, in the political sphere, you have difference in opinion, in policy and approach to policy, but deep down there was never any major division on where she wanted to take the Ministry of Labor and Social Security. She respected her staff. She respected the people with whom she worked. We kept in touch because there's family friendship going back many, many years. We kept in touch all along, right through her illness, right through, and I have to say, I have not yet met anyone who has fought as valiantly against sickness as Mrs. Shiner Robinson did. Last week when the news came that she was not doing very well, we all prayed for her, we all requested prayers for her, and the day after she passed away. I think the ministry and Jamaica should remember her as the warrior for the people, the warrior for her constituency in particularly, and the love she had for St. Ann, where she was born. This is the second minister that I am aware of in recent time who has died in office. Minister Roger Clark, who died while he was minister, and Mrs. Shiner Robinson now. And many people would not know that in most professions, when you die in the line of duty or when you die in office, there is compensation, something that you get, except when you're in representational politics. There's nothing anywhere, and I'm using this committee meeting to alert all of us who are representatives of the people. There's nothing anywhere that states what benefit does your family receive if you die while in office or if you die in the line of duty. Nothing. And I think that it is time for the Parliament of Jamaica to look carefully at how we treat the representatives of the people. May her soul rest in eternal peace, as peaceful as a person she was in life. May her soul continue to find that peace and that joy and eternal rest. Thank you, Chairman.
All right. Moving on with the agenda. We are at agenda item number 5, matters for discussion. We are resuming today after a break that, apart from the COVID, the committee had sent back the team from the ministry to do further work. As on the last occasion, it was indicated that there was in fact a policy shift from that which was originally stated in the bill. The bill in its current form, had contemplated an occupational safety and health department. But since then, the policy now contemplates the establishment recorded in our minutes and exhibited by way of an identification code. And I see here there's a letter from the Jamaica Constabulary Force members dated the 3rd of the 3rd, 2020. And of course, this was in response to a letter which was issued on instructions of the committee. So we will mark this document along with what we have here from the ministry. Yes, the letter from. As you get, yes. Yes.
Just give it a name because we're at so many numbers.
Oh, you don't recall the last number? Yeah. All right. I pause to welcome Mr. David Wan, the President of Jamaica Employers Federation. We welcome you, Mr. Wan. Of course, members, you know that on the last occasion, and prior occasions before, the committee certainly would have requested that a representative from the Employers Federation be present to participate during the clause-by-clause assessment of the bill. So we are happy to see you, Mr. Wan, and we recall that on Thursday you did in fact indicate to us that you would have been present today. So we welcome you, and do feel free, provided you are recognized and given permission to participate in these discussions. Yes. Yes, Member Daly.
I know that I have been missing from a number of the meetings, but we did raise, I remember one of the meetings I was here, that the employers should be invited to participate. They can be appointed by the parliament. But I thought, if I'm not mistaken, that we had also indicated that the workers' organization in their own right, or if we had not done so, I'd wonder if we omitted them, that the employers' organization through the Employers Federation, Jamaica Employers Federation, and the Confederation of Workers, because both Senator Lambert and Senator Cavengale here, they are not representing the workers' organization. No, please let me finish. You're the president of the Bustamante Industrial Trade Union, but you're here as a senator. You're here at the Joint Select Committee, and you're appointed by the Senate to sit here. Although you carry the noble office, and I hope it still remains noble, of President General of the Bustamante Industrial Trade Union. The Employers Federation, the Confederation of Trades Unions, represent the workers of Jamaica, not BITU and NW and so on, the wider body. And I think it is fair that if the president of the Employers Federation is invited, that the president of the Workers Federation should be invited to come, even though at this late stage, in their own right. Thank you, Chairman.
Member Daly, and I'm sure probably other members would want to speak, but my recollection is that the request came from the committee having recognized the far-reaching implication that this new legislation will bring. And members expressed a view that, that it's not desirable if upon the passage of this bill, certain adverse comments come from the Employers Federation. And even though they did participate on the invitation to make submissions before the committee was of the view that notwithstanding, because though they made submission, they were, at the time of the making of the submission.
And the submission that is being made by Member Daly, and I want to state for the record that without question, the Bustamante Industrial Trade Union is still and will always be a noble organization, just for the records. Well, there was no question about the presidency.
That would have made it not.
Notwithstanding, I can appreciate the submission. If we recall, there are a number of areas going through the legislation where the input or opinion of certainly the Employers Federation would have been helpful in guiding it. And this is a piece of legislation, Chair, where we require support and collaboration, notwithstanding the fact that since the last time we have met, a number of things would have changed that would require our attention in a more appropriate way, and also to get feedback. Notwithstanding that, whilst we understand that the trade union movement is effectively and able represented here, not only by the two trade unionists, but the other representatives. And from time to time, Member Campbell. But certainly it would be appropriate, sir, since we have the Employers Federation here, to have the balance in support from representatives of the Confederation. So I appreciate the recommendation by, no, hold a minute, because sometimes you see, whilst I appreciate your recommendation, the manner in which you make the recommendations of concern sometimes to me. But anyhow, we end up with the appropriate result. So I agree.
Member Brown, yes.
It was clear to me, and I think the other members of the committee, that there's a deficiency in our operations in the absence of private sector and employers' view. We recall that there's a member of the committee who would, just by his presence, would represent a significant view of the private sector, as he always says when he gets up to speak in another place. He hasn't been able to attend regularly. Many issues came up with nuances could impact beyond a general support for the bill, the employers, and would have loved to have had their views. The truth is, and my comrade knows this well, that a leopard doesn't change its spots, and that there's no way that a trade unionist that I am would be covered by senatorial appointment to forget and give up the wishes and the desires of the working class. So we may come here as senators, but we are fierce advocates on behalf of the workers, and that has been demonstrated in this committee. But workers also like balance and like fairness, and that's why we asked, and I'm happy that Mr. Wan has come after the many invitations from us. I was going to ask about them given the Thursday discussion we had, but I'm happy it's just a matter of lateness, David, rather than absence. So I think, and I'm not going to join the call that the Confed must be here, because truth be told, I'm a vice president of the Confed, and this leopard spots are intact.
Yes.
Yeah, Mr. Chairman.
Yes, Member Brownberg.
I just wanted to add my voice to the recognition that we had noted before about the balance that needed to be struck for the discussion. And it is true that we had thought that the voice of the workers was probably the one, the perspective from which we were approaching most of it, and that for it to really work, it needed all stakeholders at the workplace to be on the same page. So I too want to welcome Mr. Wan, and I'm pleased to have him here, because indeed, since the original consultation, so much has changed. You know, it is almost, you could say, a totally different bill, for want of a better word. So it is good to carry all stakeholders along as we have the discussion. I have no objection to the workers officially naming a representative for that kind of balance. But I believe that their perspective, that we have been trying to look at it like that. But again, those who are actually in the trenches, in those ways to better even understand the implication of some of what we are discussing and agreeing on, I don't think it would hurt to also have their voices here.
Yes, so we will send out the formal invitation to the confederations of trade union, inviting them to join us and participate as they so desire. Notwithstanding the submission from Member Brown, we will proceed in that regard. So may we now proceed to the business of the day, which is document dated May 29, 2020. And we will ask the ministry, Mrs. Camille Bennett Campbell, to.
Sorry, Chairman.
Yes.
You did mention the JCF letter.
Yes.
And we're admitted into the
As part,
records.
yes.
As-
There is a number assignment that we have been given to the other documents. I'm just waiting on the
Oh, I see.
specific assignment.
Yeah, but
so
I
that-
just want,
Yes.
I want to place on record. Remember, that is disturbing me. He's raising extraneous matters. But come on, behave yourself. Yeah, Minister. I note from the letter that there are 2,000 plus, did I get that number right? 2,000 plus members of, civilian members of the JCF. And if my memory is correct, there's about 14,000 members of the JCF. So we're looking at about 15%. The 15% of the established JDF posts. JCF posts is we have as much as that. This is a big chunk which should guide me, and I think it should guide the committee as to how we approach the JCF. It would be good also if we could get from the JDF the number of similar civilian workers who were told are critical to the backroom operations. So we could take a decision as to how we treat the JCF and the JDF. We're informed by the numbers. Well, this is a fairly high number of 15%. And we They deserve protection.
Well, Member Brown, I can update the committee that a letter was also sent to the JDF. Unlike the JCF, we have not had a response from them in this regard in terms of the...
The JDF has said it is the ministry who should provide the
Okay.
so we're waiting on the ministry.
Okay, very well. So the information is that the JDF has directed us to the ministry, stating that it is the Ministry of National Security who is to provide the information. So we have made contact with the ministry and we await their response. But as you know, we would have made certain requests of both the JDF and the JCF, having regards to certain submissions that came before us and their desire to have an exemption in certain respects in relation to this bill. So, committee, you can assist in determining how we proceed. Do we wait until the information comes from the ministry, or do we proceed with in considering the request that is made by the JCF, since they have complied?
Chairman, I think it's important that we get the information from the ministry. For us to make an appropriate decision, it would require that information to be presented by the ministry. Now, I'm not so sure, and maybe we can be told as to when we had made representation or made contact with the ministry. But if they have not yet responded, then I'm suggesting that we again communicate to them and demonstrate how imperative it is for us to receive this information that will assist us in making an informed decision as a committee. I'm suggesting that approach, Chair.
Duly noted, Member Gale. What I can say is that our request to the ministry was sent as far back as February. So 90 days would have passed. So we will send a follow-up letter. Oh, you have? Okay, I'm advised that a follow-up email was in fact sent last week. So we hope that the information will come forward not too long from now. But we are guided by your suggestion, Member Gill. So may we now move forward. Mrs. Bennett Campbell, you could now give us a background as to why. Yes.
Good morning. I will present the policy paper for the establishment of the Occupational Safety and Health Authority. Background, briefly. Currently, there's an Industrial Safety Division within the Ministry of Labor, also called Occupational Safety and Health Department. This department is responsible for monitoring and enforcing the provisions of the existing Factories Act and its regulations, such as the Factories Regulations 1961, Building Operations and Works of Engineering Construction, Safety, Health and Welfare Regulations, and the Docks Safety, Health and Welfare Regulations 1968. I won't get into detail in relation to the second paragraph because that is what we have been saying all along, but I will just summarize that the Factories Act and its regulations were limited in scope, which is why we promulgated, or we're trying to promulgate, occupational safety and health legislation, which will apply to all workplaces. Now, the OSH bill has an expanded mandate, as shown by clauses 7 to 10. The Act will apply to all workers in all workplaces and will bind the Crown. Now, Part 8, this is where we had reached in our clause-by-clause review, which is Clause 132 is the commencement, deals with the provisions for administration of the Occupational Safety and Health Bill. So what exists under the bill now is there's a Department of Occupational Safety and Health, which is established within the ministry with responsibility for labor by virtue of Clause 132. This department is headed by a Director of Occupational Safety and Health. And you would have noticed in several clauses we reviewed, throughout the clause by clause, you kept hearing about the director, the director. The functions of the director are set out in clauses 133 to 135. The director, who is a civil servant, is to be supported by a technical advisory committee established under clause 136. And the director will be supported by occupational safety and health officers who have the responsibility to assist in ensuring compliance. Now, the burden of the Crown necessitated a re-examination of the most appropriate governance arrangement for the administration of the legislation that will provide the capabilities of some level of independence in decision-making and the accountability necessary for robust and effective OSH enforcement. In light of this, the MLSS has given consideration to whether the existing mechanism from administration, as set out in Part 8, through a department and a director within the ministry, is the most prudent approach to ensure that we actually have a robust review and to make sure that this legislation is actually effective. Now, to determine the most suitable governance arrangement for OSH entity, an evaluation criteria matrix was reviewed, which is the Government of Jamaica Policy on the Categorization and Rationalization of Public Bodies 2016. This examination occurred within the context of the regulatory functions and responsibilities that will be vested in the OSH, under the OSH legislation. The result of this assessment culminated in the MLSS seeking Cabinet's approval for a shift in policy for the administration of the OSH legislation to be vested in a statutory body category 1, which is non-commercial and financially dependent entity. These types of public bodies provide primarily public service functions, are mainly funded by government, and have the ability to generate some income. Cabinet endorsed this shift in policy by means of Cabinet Decision number 920, dated March 9, 2020. The MLSS is of the view that the administration of this legislation by a public body will allow for greater independence, accountability, and efficiency. So that is the background to the policy shift. The policy changes which I recommend is what I won't go into every one. You can question me if there are further, I'll just highlight some of them. So I'm on the establishment of the authority on page 2. The Occupational Safety and Health Authority is to be established to have oversight for the responsibility for the administration of the Act. So this authority would replace the director and the department within the Ministry of Labor and Social Security. So it would no longer fall within the Ministry of Labor and Social Security specifically. It would have this entity. The authority is to be a body corporate to which Section 28 of the Inter-ministerial Act applies. This means that the authority would have the power, among other things, to enter into contracts, sue, and be liable to be sued in its own corporate name. So the functions of the authority. So what we looked at the functions of the director, and we looked at the functions of OSH officers, and we used that to frame, where it was applicable, the functions of the authority. So, in the first instance, monitor and enforce compliance with the Act. This includes investigating contraventions of the Act, initiating and giving instructions to conduct and defend proceedings, and issuing notices to secure compliance. Advising and making recommendations to the Minister and report on the operation and effectiveness of the Act. I'm trying not to read everyone unless you want me to. Read everyone? Okay. Advising and make recommendations to the Minister of Labor on matters relating to occupational safety and health, including matters of general policy. Establishing systems for recording and notification of occupational accidents, occupational diseases, dangerous occurrences, and commuting accidents. These terms are all defined in the bill. Some of them we would have discussed already. Collecting, analyzing, and publishing statistics and other information relating to occupational safety and health. Providing information on occupational safety and health to the community, and fostering a cooperative and consultative approach between all the persons with duties under the Act. 7, conducting research, experiments, and demonstrations in relation to occupational safety and health. This can be done in collaboration with other persons and bodies. Collaborating with other entities or bodies which have a responsibility for safety and health. This includes entering into a memorandum of understanding. I don't think this was expressly said in relation to the director, in relation to entering into memorandum of understanding. So we took the opportunity to try to address that. Promoting and supporting education and training on matters related to occupational safety and health. 10, certifying technical examiners and occupational safety and health experts would be vested in the authority as opposed to the director. 11, developing and promoting industry standards and codes of practice related to occupational safety and health, and monitoring compliance with these standards and codes. This includes developing standards to address toxic material and harmful physical substances and agents, including safe exposure levels. 12, registering establishments, which was addressed in Clause 40 of the bill. It would have been vested in the director before. We would vest it in the authority. Encouraging and facilitating the establishment of occupational health services. Assisting in the resolution of the exercise of the right to cease or refuse to carry out unsafe work. Formulating and developing a national policy on occupational safety and health in consultation with the minister. I believe it's the 4th schedule of the bill. Sets out what should be in the national policy. It may be 5th, 1 second. 5th schedule, sorry, it's the 5th schedule of the bill, sets out what should be included in the national policy. Any act necessary for the performance of its functions. So that would be the functions generally of the authority. Now, the entity is to be given the authority to delegate in writing any of its functions to, I believe, we had said occupational safety and health officers or any officer, agent, or employee of the authority, but based on a concern raised by the AG or a query raised by the AG, we would say officers of the authority. The authority can revoke or amend any, so that means that some of the functions of the authority, of course, they would need persons to actually assist them in doing that. They're officers, they're employees, even though they're an entity. So it's giving the authority the power to delegate some of these functions. The authority can revoke or amend any such delegation in writing at any time. These officers are to supply the authority with any information required in relation to the exercise of a delegated function. The authority is to designate suitably qualified officers of the authority as OSH officers for the purpose of assisting in carrying out its functions under the Act. As you know, the OSH officers play an important role in terms of inspections and certain compliance. So that is why it would be important. The staffing of
just before, are we going to take comments section by section, or are we going to go through the whole thing?
As the need arises, remember, we will take the comments or the concerns. Yes, very well, very well. Yes, we will.
No, yeah. Chairman, just to clarify. At 9, functions of the authority, we did discuss the question of training and certifying organization involved in training. What is meant at 9? Promoting and supporting education and training on matters relating to occupational safety and health. Does this take into account public education? Because such a campaign will be necessary with this act, or is this just about the academic training?
Morning,
Mr.
Marlon
Mahan,
Mahan.
yes.
Yes, it does take into consideration public education apart from the academic side of training. So having public education campaigns, workshops to address certain specific matters as they may arise is also contemplated.
That's fine with me. Just that I'd ask that we specifically state public education as part of the role and function.
Very well.
The other one will be at 15. Formulating and developing a national policy on occupational safety and health in consultation with the minister. I kind of understand where you're going, but given that cabinet is the chief policy agent, thank you, the word in consultation with the minister kind of sound like it waters down the role of the minister and the cabinet. And if it's going to be a policy, it can't be just this authority developing this policy. It has to be approved. And so maybe it's about the language that we use that capture what we intend here. I just raised those two.
Mrs. Algeria, you had a comment?
Good morning. I apologize for being late. Yes, Senator Brown is correct, but there is a standard way to craft something like this where you recognize that the authority would have the duty or the responsibility to develop the draft policy, and then they would then submit that draft policy. What I think should have been captured, though, is not consultation with the minister, but consultation with stakeholders. Because of late, that is what we have been doing in more modern legislation, where we talk about when they are developing these types of documents, they must consult. And then it would be submitted to the minister for the minister's review and determination thereafter.
Yeah, you're satisfied, Member Dali? Yes. Yes.
Yes. We pointed out the far-reaching nature of this Occupation Health and Safety Bill, which will become an act and its attendant regulations. In fact, I, at one of the meetings, appealed, and several members spoke from this committee, appealed to the private sector, appealed to large industrial entities to pay attention to this bill, because it has far-reaching implications. Our recent experience with the corona pandemic, I think, drives the point further home that we are now in a brand new normal, a brand new workplace environment that we have never been before. And that is why I am extremely happy that the Jamaica Employees Federation president is here. That is why I expressed my appreciation, and other members did, when the large companies like JPS and other entities came to make presentation at the committee. The things that have unfolded in recent weeks and months confirms how important it is for us to even have a quick review, us meaning the technical people, of the connection between the Occupational Health and Safety Bill that we are debating and the Public Health Act, under which we are operating under the pandemic in some instances, the Quarantine Act, and the Disaster Risk Management Act. I am suggesting, since there's going to be so much involved in the work of the authority, the Health and Safety Authority, whatever we want to name it, that's the prerogative of the Cabinet. Occupational Health and Safety Authority, Health and Safety Authority, whatever it is, that there is a fundamental connection between that authority and existing bodies, existing acts, existing agencies that carry out health and in some instances safety, promotion, regulation, etc., etc. So I'm appealing, it's really an appeal in light of the new situation that the workplace, who will, under whose instructions or under whose authority will we authorize that a BPO is now fully safe for the workers? A committee of the Cabinet? Public Health? Quarantine Act? I'm just raising these as points for us to look at, because as we all agree, this is far-reaching. And I'm just asking the technical people to, bear these things in mind, and quickly before, we're not rushing you, but we need to get this passed quickly to see how do all of these will link as we move forward. Thank you, Chairman. I don't know if I've sufficiently expressed myself. I'm not one who is very eloquent with words like.
No, you're not short.
Like
You're not short on words, remember that.
Or Senator Lambert or so. But I hope
the point has been made.
that I've sufficiently expressed myself so people understand what I'm trying to say.
I recognize you, Member Skeffrey, then we go to Member Gill and then Member Brownberg.
Thank you, Chair. As I looked at the policy or the proposed policy before us, well, it's a policy because it seems that it has gotten Cabinet's approval. But I still want some clarity in terms of the shift to the authority. Initially, in the bill before us, we have the department and the officers operating in the Ministry of Labor and Social Security and the labor officers. Now you're going to shift to an authority which seeks a level of independence, hence they operate on their own. I just want to know in terms of the whole employment status, security of tenure and so on, how will we get these officers into an independent authority that basically, as I see the policy, don't have a direct link with the ministry. So is it a matter of redundancy, re-employment, and the security for the officer, their benefits and so on? Because this is a fundamental shift. Yeah, no, I see the staffing, but as I read it, it's not clear for me also. I speak about staffing and the director and so on, but in terms of the specific, you now have inspectors under the Factories Act, and they would move to OSH officer under the current bill once it becomes law. But then we're going down that trajectory, and then we have, this is really a fundamental shift. The bill is a fundamental shift, and this proposal to an authority is a fundamental shift in the bill. So in terms of our own monitoring and the relation between the employer and the employee at the workplace and so on, this authority now shifts the whole focus. And therefore many clauses that we have basically signed off on initially, Mr. Chair, I think we have to actually revisit them once we accept this. Well, I don't think we have a choice because the committee deliberation is not to the policy per se, but we have to understand it in the context of the bill. But I'm not clear exactly as to how the OSH officers will operate in this new proposed context.
Members Kefri, I know we stopped just before we're looking at the point of staffing. So perhaps your question could be deferred until we would have gone through that section of the document.
Except, Chairman, it doesn't. The document does not explain, it doesn't answer that, and that's another concern that we have.
Hence, because I just look at that
those
staff,
assumptions. If someone is going, if someone is currently a civil servant, and if they are going to be re-employed in the new organization, you would have to make provision for it. And normally you have transitional provisions that address all of those issues, but that's not addressed in the document.
Very well.
So, Chair, you see, there are more than one or two trade unionists in the room. So Senator Skeffrey would have been learning on Fridays. Indeed. Because that was one of the first things that jumped out at me in terms of, we spoke about the role, separation of powers and the roles. And so one of the first things that came out at me is in the bill, we spoke about the labor officers, the OSH officers, and all of that. And the security of tenure now, because if you have OSH officers defined in a particular place, and you would be utilizing these officers now under an authority, with different terms and conditions of employment. How is that transition going to be made, right? And when I went through it earlier this morning, I never saw that being expressed in the submission. The other thing is that when you look at the functions of the authority, one of the things I would appreciate, because whilst it's being specific, there are certain functions that give rise to how you collaborate with stakeholders, right, in the carrying out of your mandate and objectives. And whilst these are specific functions in terms of who you interface with, some of them might very well require an interface with stakeholders who are in labor, stakeholders who are employers, but not necessarily as specifically point out here in terms of just merely dealing with occupational safety and health. So maybe some of the wording might want to suggest how you interface with stakeholders as part of the functions of the authority. Now, 14, in terms of the function, assisting in the resolution of the exercise of the right to seize or refuse to carry out unsafe work. Now, that particular area under the legislation is one of the most critical area in terms of getting a clear understanding as to how we treat with it. And I know David one is here, And I can just imagine when Mr. Wan sees number 14, he might be livid if it's not clear in his mind in black and white how this particular area is treated. So he can guide those members of his federation, right? And knowing very well that this particular area can be an area that give rise to disputes or grievances. I just want to have an understanding, Chair, and a clearer interpretation in my mind how the functioning, this particular function is going to work. Because I recall us speaking about whether or not it's going to, some of these particular issues are going to go before a tribunal of some sort. So it needs some level of clarity in my mind. Thank you, sir.
Member Brownberg, I recognize you then. Member Cuthbert Flynn.
Thank you, Mr. Chairman. Mr. Chairman, you know, I have been here wondering whether or not I should raise the matter, but I think I'm going to raise it just for certainty and for further clarification. Item 10 in the functions of authority, and I'm glad for the question asked by Member Brown about 9. So that was part of the concern I have. But let's go to 10. I remember we were having the discussion about certification and so on. I wanted to be clear that these were not, then it would have been the director. They would not be arbitrary. And that the standards or what will be required for certification would be clear. And I suspect that that is what is meant. I'm not sure if how it is written makes it clear. But then again, I am assuming that this is not the language of the bill itself, and therefore it will be clearer.
The drafters will.
Right,
Yes.
okay. Thanks. I just still wanted to make sure that I placed it there. The other thing that I think could be inferred but not clear, and because of the issues we have had traditionally around public education, I thought that it needed to have been much clearer identified. I know that if we talk about promoting industry standards, for example, and stuff like that, we assume that part of that is public education. But in Jamaica, where sometimes we believe that the only stakeholders that we're talking about would be the employers and the employees, and we forget that as we move into an era where we are more conscious about occupational safety and health, that is a matter where we have to carry the public along with us as well. And so I'd want to see the role for public education also being specified in what we're doing. Those are 2 comments I wanted to make.
Member Cuthbert. That's Member Gill. Mr. Mahon, do you have any? Yeah.
Chair, just before Mr.
Member
Mahon, I'm glad that Member Cuthbert Flynn raised that point. point, because every piece of legislation must have this practical side to it, or applicability is not something that we design in the air. If I am a worker, I turn up at my workplace, real case scenario, Senator Gale, and I'm represented by the by the National Workers Union. And also, I am in close contact with the Bustamante Industrial Trade Union, because we have a joint bargaining unit at the workplace. But seriously, I arrive at my workplace, and this big factory owned by Mr. Wang. And I, as a worker, feel, David, that this is not safe for me today. I smell something, or I hear other people coughing and sneezing, and I'm not working. How do you resolve that? What's the practical way of resolving such a thing? And that is why, with this bill, with the new bill, that is why I said earlier, if you have 400 workers at a BPO on Constant Spring Road, and they say that people getting sick from the other day, people have been talking, 7, 8, 9 members of our shift getting sick. What triggers the investigation, and who? It's a good example. We spend about 300 million renovate a section of the Oceana Hotel building complex, and put in the administrator general down there, I think, or one of the companies. Air quality was bad. It was renovated again. Workers become sick. They went to do the inspection, the Ministry of Health, factories people, and the relevant people. But they had to evacuate. They have to move out now because a sick building for the workers. People just not keeping well. How does the worker trigger that? This is basically what Member Flynn is asking, and I think all of us have an interest in under this bill. Now, how would you trigger something? Is that?
Yes, there are express provisions dealing with that, but Mr. Moore or Ms. Benny Campbell?
All right, morning again. In terms of the concerns raised by Member Skeffrey, the transitional arrangements, we are still having some discussions with our principals as to how best to put those arrangements in place, because we recognize the fact that we have to really spend some time and ensure that there's some reconciliation between the powers of the authority and its functions and how it's going to be delegated as well, to determine the best ways of how we are going to be doing that transitional arrangement. As you are aware, the Occupational Safety and Health Department, which is by law the Industrial Safety Division, has around 16 officers, and we have to now consider that for the new entity, once we have our organizational review and to determine the positions that will be required to do the administration under this bill, we would now have to see how best we will be integrating these officers or inspectors, as we know them, into this new regime under this authority. So we're still having some discussions in that regard. We have received some comments from the legal teams as well in terms of those considerations. So we are doing some research. We are looking at other acts and regulations to see how they have done such arrangements, and we will revert to the committee in that regard. As it relates to the issues raised by Member Gale, the resolution and the exercise of the right to seize or refuse to carry out unsafe work and goes all the way to the tribunal, we have provisions that are set out in clause 83 going forward to treat with that. But as we had mentioned in some other sittings before, the cease to work is not a clause that is one that we expect to be the first response to a safety and health issue necessarily in the workplace, because looking at how the bill is structured, it speaks about having joint safety and health committees, safety and health representatives. We have collaboration happening, the representation of the workers. We speak about the primary duty of care of the person conducting the business or undertaking to do the risk assessments that are required prior to people doing work. So all the hazards are identified and the appropriate control measures should have been put in place. So it is not a activity that we would envision to be happening frequently if the PCBU does its primary duty of care to ensure that the workplace, all the risks are identified and the appropriate mechanisms are put in place. But
Chairman, just a clarification.
Yes,
I
Member
think
Brown.
what is being, through your chair, what is being questioned here is, given the new architecture, how does that relate to 82.4 at page 69 of the bill? In other words, you no longer have conciliation officers. Will USH officers be the first port of call? That's what is being asked. And since you're going to be also be involved in determining whether or not it's an unsafe practice, where does your mediation, conciliation skills come into this? Have you given thought to that?
Mrs. Benny Campbell, you want to come in?
I know it had been a little time ago, but we had actually presented a change of policy document in relation to the right to cease unsafe work. And it wasn't totally finalized because we were waiting on the JCF and the JDF to finalize it. But the mechanism that we had outlined there, because of you have stopped work, it was the director who was going to come in and inspect. So what I think we have to do is the document we had submitted to you with that whole change of procedure, to refresh your memories, I think we have to just realign it because we were not going to conciliation with that particular matter based on what we had discussed here at the committee. Because within a certain time, an USH officer was to be on site to inspect. So I think we have to just take back that document to you and put in just the change now with the authority.
So you're saying it's not clear as to how we're going to do that part. You have to get back to us what you're saying.
Right. In terms of in our mind, but I would like to give you back the documentation where we had outlined the policy, because we had done step by step what must happen with the right to cease unsafe work. So I'd prefer to put that document back before you with the authority worked in, so you can look at it in that context.
Yeah, through your chair.
Yes, Member Brown.
Is the intent that the first port of call will be the USH officers?
The authority. It will be the authority.
All right, so, and the authority essentially is made up of the director, the USH officers, and employees. Is it, other than the director, the employees who are likely to be, and not the USH officers, the first port of call?
Remember, Member Brown, that in the bill there you have what you call safety and health reps, I believe.
But Chairman, the safety and health reps at the workplace,
yes,
they may instigate or call cease work. They may not even be supportive of the cease work, but a cease work has gone because Cavan brother, who is not a delegate or a safety rep, feels strengthened by the fact that he has the UAW to back him. So he says, stop work. I think you have to talk to your public. So the question is, when that happened, under the old arrangement, a report is made to the Ministry of Labour where conciliation comes in, and then conciliation may pass it on to us. So we know after it leaves the local level, it is conciliation. Now, when it leaves in the new dispensation, when it leaves the local level, to where or who does it go? Is it ASH officers? Because then the ASH officers have some responsibility after to determine issues. To determine after. And so we just want to get a sense. Maybe they're not aware of where they want to go yet. Tell us that and we take it.
Mr. Chair.
Yes. Oh, Member Longmore.
Someone is going to a response. Good morning, everyone. Sorry about the tardiness. Is someone going to respond? Or can I ask my question?
Yes. Mrs. Bennett Campbell, in respect of, or Mr. Mohan, based on the point Member Brown has raised.
Yes.
That is what you need to
So in terms of the conciliation part of it, I think at a previous sitting we had mentioned that the cease to work was such of importance because the cease to work is in a context when there's imminent or immediate exposure to a hazard that can be resulting in serious injury, illness, or death. So rather than having it going through a conciliation process, as our Member Brown is speaking to, we would want to ensure that we have the authority, as how we are speaking of now, to be notified so that they can quickly come in and address that issue.
Just a follow. Yes. Just a follow. So, the first port of call is the authority. The authority is not separated from the ASH officers because the ASH officers operate on the basis of the authority. Second stage, we disagree with the set of ASH officers there. Who takes the next decision?
Mr. Mohan?
Right. So you're saying that if there's a disagreement...
You know, I just asking some questions.
The question is, if it is that when contact is made with the authority, there's no resolution, where do you go next?
Well, there will be an administratively escalation to probably supervisors to get intervention into the situation. But then our reference point is ASH, right, inside the authority. But at the end of the day, any action that is done by the authority and by extension the officers will be in relation to some contravention of section of the act or the regulation or a code of practice or standard. So we have that as a reference point to use in determining if the action of ceasing to work is justified. And it is expected that once the officer enters and recognizes that there is imminent and immediate risk to the safety and health of the worker, then what he would have done was issue a prohibition notice. Because
sorry, what if the employer says, I don't agree that there is a breach at that point? So there's a dispute continuing. Or the worker says, I don't agree that there's not a problem. What is the next step? You're saying to us another grade of ASH people?
Mr. Chair, if I may, and Mr. Mahan, Senator Brown.
Yes, Member Longmore.
What I want to question may be relevant to what Senator Brown is seeking to clarify, and yes, maybe also help to, I think, elucidate a bit of the process that might need to happen here, because I'm concerned about the fact that throughout this entire section of the legislation, there's no reference to a medically confirmed risk of health being at risk. And in 85.1, page 70, where it relates to have a reasonable So refuse the representative to cease or refuse to carry out work if the representative has a reasonable concern. What defines reasonable and who verifies reasonable? And if it is a matter where usually something like this in other spheres, you would have to have a medical report or a verification of the health risk that this would obtain. If we have that process being followed, what Senator Brown, I think, is trying to ascertain and to prevent is another layer of red tape. So if you have the intervention of a medical confirmation of said reasonable question to health, it then becomes a verified, if I consider it a verified fact that you could move on and expedite the process thoroughly for the worker. Because what you're asking, Senator Brown, is now after this refusal and maybe the question as whether or not the person's health is, he says yes and OSH officer said no or management said no, whatever, you will circumvent that whole need for subsequent verification. Verify it earlier. Just saying. And from then now, it goes directly to a tribunal or whatever. I don't know the legal ramifications and stuff, but to some resolution. So, yes.
Yes. Member Daly.
Chair, I am just appealing to the legal minds who know this bill inside out, who have been working with this bill for the past 20 years, to just spend the time. And I'm also imploring the Employers Federation and the union leaders, spend the time to look at 68, the function of the health and safety representative who is a worker that you employ, who has now taken on a new title, and their function, and the section that deals with right to cease working as a result of health and safety concerns or reasons. Because in this new normal, I would hazard a guess that if this bill were in operation now, would have had severe trouble in the society resuming work this week, today and going forward, because today is a normal resumption of work. Because there are many work centers, many workplaces that are not ready and safe for the workers in their employment. And I'm telling you, I am asking, I am appealing really. I'm appealing. Pay some attention, go back and review, read, compare, look at the other sections and see what are the impact, what are the implications of this right to cease or direct cessation or direct the cessation of unsafe work. Thank you.
Member Gill.
Chair, you know, there is a fundamental reason why I raised the concern regarding number 14. Because number 14 can be the basis for a dispute. The Labor Relation and Industrial Disputes Act clearly outlines the means of which we can treat with disputes through the varying procedures. Now, the role and function of the authority in this case, based on how they respond, they can be viewed as parties to a dispute. And if there is no mechanism in place to treat with how we properly resolve, which outlines certain escalated procedures, then we're going to be in trouble. The other thing that I would want to see in this scenario is a clearly defined outline in terms of the separation of powers of the roles and functions of, you know, you have the labor officers, you have the USH officers, you have all those respective officers. You're still going to have functions at the Ministry of Labor. And so I would want to see some understand. So there's a clear definition in terms of the separation of powers, so that there's no overlapping. There's no overlapping whatsoever. It may be that the authority is seeking to have. It may be that the authority is seeking to have some of these officers defined in the authority itself. But I would want to be clear in terms of two things. A distinction in terms of the separation of powers, now that we are going to this new policy approach, and also the scope in which that is going to be identified to treat with resolving either issues, as you had referred to it earlier, or disputes, or matters, right? That's important to be defined.
The point is duly noted, Member Gale. Mr. Mahoney, had a further comment, or may we proceed to staffing?
I'm tempted to ask a question that I don't want to ask, but I'm going to ask it now. No, I'm going to ask now. I don't want to, but I'm tempted to, and I'm going to ask it anyway. To what extent in the development, I'm being me, to what extent in the development of the policy document, and having regard for the implications for the bill, have there been consultation, collaboration with the other technical side? It can, I've asked it.
Yes.
The other side?
Yes.
Well, put this way, the other technical team, well, they're all one, but to what extent there was that cooperation, collaboration,
yes.
consultation?
Mrs. Alger, do you want to comment?
Yes. The AGC sent comments yesterday, and legal reform sent comments this morning. You sent comments this morning, right? I think, over the weekend, legal reform sent comments, as did the Attorney General's chambers.
Yes.
Had discussions, and then I would have sent
Plus, there was a
comments to me.
meeting. There had been a meeting. There was a meeting, but we sent more specific comments on the actual policy document, which is one of the reasons why I had an intervention earlier, and I was waiting for all the comments of the members to then just make an intervention about the functions as well.
And Chairman, normally the comments of the other agencies, apart from the Ministry of Labor, would be shared with the committee.
Well,
I don't know if there's a difference this time around. I don't know if there's a difference this time around. But it will appear to me that we're discussing as a committee this document prematurely, because I'm not sure from what I'm hearing, since this document was sent to us prior to yesterday, that it has benefited from the intervention and the ideas and suggestions.
Member Brown, what I will say is that my understanding of that this final document would have taken into account the comments from CPC, legal reform. Yes, that was there were meetings before too, and the only yes. So the 29th dated document would be the final document that would have incorporated the comments from the AGC during the meetings, the legal reform, and CPC. The AGC sent their comments, I gather, last night. I have not had sight of the AGC's comment.
Your answer to my question is yes, there have been cooperation, consultation, and so forth. But what I'm hearing today is that the AGC comment was sent last night. And since I got and read this document before last night, it certainly was bereft of the AGC's comment. So which make the answer to my question really, in fact, no.
Well, I think, member, Miss, the Solicitor General wants to make a comment. So I'll allow her.
So let me try and again be clear. There have been discussions, and there were meetings with the AGC, LRD, OPC, and the ministry. It is true that in terms of very specific comments, the AGC sent them yesterday, and Legal Reform sent very specific comments in relation to the document you're reviewing over the weekend. But I still don't think that that will take away from the discussions you are having here, because the kind of comments we have are more from another perspective. Yes, it may impinge on policy, but a lot of the matters that you are raising are really mostly policy that I still think there is value in what you're doing now, and it won't take away from the fact that our comments are not necessarily incorporated in this document. And it just means that after this meeting, the ministry can then have a better idea. Because, for instance, I am here, I can raise the issues that I have. You may not agree with what I am saying, so you can then give further guidance to the ministry on whether or not it should be incorporated. So it is true that we had the document for a month, but it took us some time to go through the provisions. And in fact, I would want to tell you that to an extent, we are not even our comments are not necessarily full comments, because I think there could be other implications for the bill that we have not yet been able to take into account. It's a huge bill, and the scheme is changing, so it's not a very easy issue to tackle. And so even though we will have some comments now, I am sure that when we're going through other parts of the bill, we will still have further comments to make. It is one of these things where we keep evolving in this bill as things are changing. And this is a fundamental change, Chairman, in terms of the scheme of the bill. So we apologize that we took a little time to do our review and send our comments, but I don't think that should be used to delay the proceedings, because I still think that our comments are coming from a slightly different perspective, even though, yes, it may still impinge on the policy.
Chairman, I want to make it clear. Sorry, Carl. I want to make it clear.
Yes.
I don't want to delay this bill. I'm on record of saying I wanted it as an independence give last year. Secondly, we are under pressure as a committee to get this thing. I've never heard PPE used so often in the outside of this committee in the country. Everybody says PPE. So we could almost call this bill the PPE bill.
Yeah, I've never
right?
heard it before.
So everybody is saying we need to get a real thing. Be it call center, be it tourism, be it manufacturing, be it agriculture. We need this bill now. So I want it moved. The problem I have, Chair, Minister, is when you pass a bill and then you hear somebody get up and say, but the bill maybe sitting somewhere around here, so saying the bill has deficiencies, and you can identify a spot for me, Angela, where the person usually sits. And it have this, and it never take that into account, and it piecemeal, and it can't work. So we need a different approach. So I want to make sure the bill that we have, and it's not the SG we're talking about here, maybe another G, but not the SG, right? What we want is a bill that when Come on, behave yourself. Did you say a different M? Yeah. So what we want is, and now David is there, and come on, Senator Gale raise it. We have a dispute at Party Shop B over the oven and the eats coming from the oven, or whether or not we must go and deal with the parties as they come out of the oven. Let's take that as an issue. With or without maybe with or without PPE. So we have a problem. So Johnny said, because he might have been vexed about something this morning, said, we now work, it's unsafe. And everybody said, we now work, it's unsafe. How do we deal with that? To whom does, hold on, Juliet, to whom does Party Shop B report that issue? Or to who does Johnny report that issue? It says in the whole arrangement to the conciliation officer. Conciliation officer move quickly and brings in the ash officer. We're going to get rid of the conciliation officer now. So it goes to the ash officer. In the whole dispensation, after it goes to ash officer, it goes to tribunal. What I'm trying, and the ash officer has a key role in making a judgment whether the place too hot or whether it's safe or unsafe. Having done that, do I go straight to the tribunal now, or do I go to a new level of ash officer? That's not clear. And so I've not received from the technical team from the ministry where they are at on that. And that's important for us to know as we go forward.
Member Brown, I think under, there's a section on in the bill, resolution of OSH issues, section 80. Yes. And I believe that a position would have been presented to the committee by the ministry. And I see here the substantial reference is to the director with responsibility for conciliation. As you know, we are moving away from that. We are going to the authority. But 82.4, yes, is indicating that the option does exist in the event that the issues are not resolved for you to go to a tribunal. Yes.
Chair, really.
Yes. Mrs. Betty Campbell?
Yes, I may have missed something, Minister, but if you would recall in relation to OSH issues, resolution of OSH issues, the committee had sent us back to do further work. We were changing up what was on the face of the bill, so they sent us back to do further work. Right. So that part is not complete because we were sent back based on...
So it is on the... Yes. Well.
Right.
Chairman, I've been asking that question all
for
along.
the longest while.
And so the answer I'm getting that they're not yet ready. All right, so we don't need to continue this discussion and this because they're not yet ready on that.
Yes.
So the policy point at 14 is not, they're not ready to speak to us on that yet.
Mr. Chairman, go ahead, member.
Okay. Mr. Mahon, you wanted to say something?
Yes.
And then we'll move back to you, Member Brown.
Right, because what we are really speaking to was the context in which the season would have been happening. The ash issues, as Ms. Campbell spoke about, that is what we would have been used to deal with, those other types of issues in terms of heat and so forth. But I also wanted to respond to what Member Longmore had asked about medical certification. And although everything cannot be placed on the face of the act itself, that's why you have regulations. When it comes down to matters of health, because that is what you spoke to, just as though in the Factories Act, it speaks to under Regulation 77 of the Factories Regulations that says that when there is any incidents of occupational illnesses or diseases in the workplace, then the ministry has a responsibility to inform the chief medical officer, who will now assign the medical officer who will be responsible for conducting an investigation into that matter. So what we are contemplating is that, as Member Daly was speaking about the nexus between public health and the other acts and so forth, when it comes on to the regulations, that is where now we would be trying to make some of these linkages, because we have to understand that there's a separation between occupational safety and health and public health. And when it comes on to matters of health and public health, we have to give credence to the fact that the expertise would reside under the umbrella of the Ministry of Health and Wellness. So I just wanted to make that point, that it is not that we have forgotten about that link, but we will be making those linkages when it comes on to matters of health.
Okay, thank you for that clarification. But my concern is not very well resolved, to be honest with you. Because my role on this committee is primarily as a physician and who puts the health of the individual foremost. Any occupational health and public health is in no way separate in my mind. Absolutely none. There is no occupational health risk that is not a health risk, whether it be to the physical health of the person, the mental health of the person, the emotional health of the person, the social health of the person, or the spiritual health of the person. You're very limited, I think, and what we're seeing is a legislation is very limited in recognizing what health is. Now, my concern with the red tape and the question I think that probably Senator Brown was also elucidating too, is the time that it is taken for an individual to recognize that something is not to their benefit health-wise whilst working and is being exposed to it. The time that is being taken to come to this verification is time that that person's health is deteriorating, likely or because of the conditions that they're complaining about. I go back to my question, why is it the verification? You have gone through OSH consultation office, and I'm learning all of this legal and work thing. Consulation, OSH officer, then to tribunal. The tribunal is going to have to get the medical certification. Why are we waiting and writing it into law that of someone who sees their health at risk has to wait until it goes there? Why are we not allowing private, even private, a medical verification is a medical verification. If it is a matter where we don't want to put that level of authority into one medical personnel, you say then, okay, it escalates from one to maybe a team of 5. But why are we going to wait to kick this can down the road for this verification, for the intervention that the person is seeking, and they are at risk with their health in whatever respect that health is? So I think there is something that we really need to, and I'm glad, I'm hoping it is definitely going on record, that as a medical practitioner and who is primarily concerned about the health and healthy functioning of our workers in their workspace, work environment, whatever that case may be, virtually or in physical presence, that should not be delayed by the process to prove that they are at risk.
I just wanted to know, have you already answered that? If there were any comments on, it's on. If there are any comments coming from the issues that I had raised earlier.
Yes. So Mr. Mahon, Member Brown is saying that, indicating that her question or the points you have raised have not been commented on by the ministry. You may want to comment on the...
Sure, no problem.
Yes, the points raised.
So could I just follow up on what Member Longmore said before I step in? Just to say that what I outlined was the mechanism in terms of a time frame for that to happen, in terms of any referral to the Ministry of Health and Wellness and the Public Health. That is something that when we put the regulations together, then it would be a matter of immediacy. In terms of 13, in the same functions here.
In that respect, what I would love to see, maybe I should say what my end result would ideally be. I would ideally love to see where it is possible for a worker to come with a medical certificate, take it to their OSH officer, and that is recognized as enough, or whether you want it from 2 or 3, recognized as enough to see to the tribunal, to see to that process.
And it would not have to reach so far, because under 13, if you look at the functions of 13, encouraging and facilitating the establishment of occupational health services. So under these services, what you're speaking to, it will be facilitated. It's just that this is a policy document and we're not going into the finer details of how it is done. But it will be facilitated. Because occupational health services, if you look on page 12 of the bill, definition, clause 4, you will see where it is defined as how you have set it out. The only thing is that it didn't speak to the spiritual part of it, which we had some long deliberations on that on a previous sitting. But it does mention the whole role of the health side in terms of occupational safety and health.
I was just wondering, in relation to Senator Longmore's concern, when you look at clause 84, which speaks to the whole issue of reasonable concern, can we then not incorporate the concerns that she's raising upon the issuance of a medical certificate as one of the reasons why you may be able to cease and desist? So you expand clause 84 beyond that reasonable.
And I'm sure the ministry has no difficulty in examining it in that regard.
Thank you.
Yeah. Well, the ministry will be looking back at clause 84 and the comments and the concerns as raised by Member Longmore.
In that case, just to add, reasonable time would be effective because it would be dependent on the variation of the medical confirmation. It could require testing, etc., etc. So, within reason,
Yes.
Chairman?
Yes, Member Brown.
I'm in the workplace.
Yes.
And just take this building.
Both as an employer.
If the people, often the technical people, sit under this balcony here, and they feel or see some signs of a crack or something like that, it's not a doctor they want, you know. They may need an engineer opinion. If they're under there, and they feel it's unsafe, or put another way, we come into this building and we smell paint that is affecting us. We're not going to call a doctor to say, can you check the scent level of the paint? It may be somebody else, all right? And we can't wait for a reasonable time. We must act now. So, the events which may give rise to a desire and decision to stop working may be immediate. And so I am wary of the reasonable time, etc., etc. I am going to rely on the advice and the experience of the technical team. I remember climbing upon, as a child, climbing upon a house top, you know, and the entire house come down with us who were on top of it. Some of us might have said if I was to be working on that house, it may not be safe. When you go down to a hotel under construction and the deck there, and you begin to hear or see some, You're not going to call a doctor to come and check it. And we have had cases where people have died. So I'm saying that the nature of the events which may give rise to that is beyond, some of it have a medical side, Senator Langmore. Some of them is just an engineering side, and some of them would be something that the member senator would be very familiar with. It might just be my mindset this morning, you know, that lead me down a path, which is why when the ash officers come in, they say, well, there's nothing here. And then we then have to call in Senator Langmore and say, why is Lammy? Yeah, why is Lammy
Why do I
behaving
need to
so?
pick up my prescription
Is he
pad?
mental? Right?
Mrs.
Mr.
I'll
Chair.
allow Mrs. Member Longmore, I'll allow Mrs. Seeley Brown to come in before you. Yes.
And that's what I was going to say, that it is accommodated. If you look, Senator Brown, at the definition of risk, it speaks to the health effects, which is what Senator Longmore is concerned about, and it goes on to speak to loss or damage to property. And when you look at the way even it is set out in clauses 80 to 84, it also includes hazards, and the term hazard is very widely defined also. It even includes psychosocial hazards.
Sorry,
so I think
loss or thing to
Yes, so
property
it's-
is psychological too. That's health.
Yes.
All of those are
Yes.
health.
So but there is also damage to property. That's what I'm saying. It is widely defined
Yeah, but that's your
incorporate both
okay. One matter of observation here that
Yes.
Senator Brown triggered and such. We are dealing with so many health issues in this law. It is around the health of our workers, and I just realized we have not one single primarily health trained person on the technical team. That is a gross, I think, overlap. That's a big lapse. How can we not have a medical person, maybe even someone in public health? I think it would relate to a lot of these contemplations, etc., etc. But we're dealing with the health of people. Just bringing that to our awareness. There should be someone guiding and inputting at this level from the health. Even if we got submissions, member, I agree, yes, submissions will be helpful, but that is a fundamental element to draft in the legislation, I think.
At the risk of...
Recognize your member, bro.
No, I'm just wanted to add to that. I am hoping that the response does not confirm that there has been no consultation, discussion with right, absolutely. And I'm expecting that the ministry, right, would have ensured that the contribution from those individuals would have been a cornerstone to what is being brought here.
Wait, we get a new chairman?
I can mute you if you wish it.
One day Busher, still Busher, you know. I'm going to be fair. I'm going to be fair. No, in the comments on this non-collaboration or what, and maybe the members can respond to the committee as public servants. If you have had any discussions, dialogue with the Ministry of Health. But I will go a little further. The Occupation, Health and Safety Bill has always been seen as a Ministry of Labor bill. Our Ministry of Labor carrying out this thing is 20 years. That's passed through 7 or 8 ministers. As I said once, Ms. Cuthbert Flynn don't like when I say it, but I saw draft number 10 as Minister of Labor. They brought to me and discussed whole half-day retreaters draft number 10 of the bill. And that's years ago. The very few persons on this committee, except the medical person we have here, Dr. Longmore, paid any attention to the Quarantine Act prior to COVID-19. Very few persons even realized that there was, well, I'm just telling you, the Quarantine Act, that there was promulgated few years ago, the Disaster Risk Management Act. Thank you very much. 2015. Very few people paid, while we developed and discussed this bill here from last year, very few people remembered the Public Health Act. Very few. And the connections. Having seen what we have seen with the pandemic, all the committee members, and I can hear it from all sides, asking, is if you have not yet done so, just find some time to have some little discussion, collaboration, or examination of especially the Public Health Act and the Quarantine Act to see how they will impact on the Occupational Health and Safety bill that we are discussing. Reason being, as I just repeat, no, everybody thought that OSHA is Ministry of Labor. Ministry of Labor, and I said, every single store at West Street, every man from China come work my wholesale, every large factory, every business in Jamaica will be affected. Every service provided will be affected profoundly by this Occupational Health and Safety Act 2017 that will eventually be promulgated into law. And therefore it is important that we, in the final stages of the deliberations of this Joint Select Committee, that we consult and also check with the other accompanying or sister legislations that will impact on the bill.
Go.
Yes, Member Gill.
You know, since March, was it March 10th or March 11th? 10th. A lot of attention would have been placed on occupational safety and health. All who never know about it now. And the numerous persons that would have been asking, where is this piece of legislation? Why is it not being passed? Including numerous employers. So what it tells us, is that we have to take even another look as to what areas of the legislation we're going to treat with pandemics. And I mean, even in the code itself, section 12 of the code, 12.1, speaks to the prevention of the spread of epidemic or infectious disease. Yeah? So the other concern I have is that you have all these industries now developing protocols, and they are developing protocols and establishing health and safety committees. And we have to be cautious that some of these committees developed under that dispensation is not overlapping in the boundaries of these that are required to be established under this piece of legislation. So we're going to have some tripling over. I am mindful of the technical team's response that we have not seen, and sometimes when we see these responses, it informs us as to how we approach these deliberations. And it will be helpful to see those responses so that it can assist the process. Yeah? We have not met for some time, so we now have to streamline as to how we are going to pursue these discussions and go along. But for me, this discussion has been very helpful this morning. And it guides us in a particular direction. And yes, whether or not there would have been an interface, and I'm trying to look through, initially when there were certain ministries and agencies that would have been invited, I have to look back to see if the Ministry of Health was one, but now the Ministry of Health is very important. So I await the comments from the other technical team, so,
Chairman.
to inform.
Yes, Member Brown.
Not for the first time, I've raised the issue about the process of developing this bill. I spoke about the bill going to cabinet, coming to the legislative committee. Now, in cabinet sits the Ministry of Health. I don't know, because cabinet discussion is confidential, whether they made any comment or not on this when it went to cabinet. I know also in March, it went back to cabinet for the policy change. I think it says cabinet decision of XXX, or should I say Ray. Because that is the equivalent, it's the equivalent of an ellipse when you speak. When you write and you put dot, well, Ray is just the equivalent of that ellipse, right? But the point is, health had a chance again to comment on it. Would you recall, Minister, that the Ministry of Education came here and said they thought they were exempt from the bill? So I'm not sure if when the bill went before cabinet, education gave it thought, because we made it clear to them that, oh no, you're not exempt. We also had representative from some of the agricultural agency who had different views, and they also helped us in understanding things like forests and so forth. We had national security who came through. And we had a number of private sector entities who took the initiative in response to our requests for submissions to come. So I fear that we have not had that type of look-in from the other agencies. And I don't want us to delay in doing that. But I want to make it clear, Minister, and I hope you don't listen to what I'm saying. But this bill, especially in light of the pandemic, and what I heard the Minister of Health said yesterday, which really shocked me, that with the opening, we could get an increase plus community spread. And I'm saying, did he really say that? And I see Susan Goff tweeted out the same thing. So I'm saying, yes, he actually said that. No, but given that reality, Minister, this is what I have to say. I, and all of us in here, regret the passing. Stephen, we regret the passing of the Honorable Shiny Robinson. This bill and its passage as soon as possible ought to benefit from having inside the chief organ of policy making those who understand the bill. And Chairman, I don't want you to listen to me, but the chairman of this committee, the Minister of State in the Ministry of Labor, has demonstrated tremendous knowledge and skill in guiding us. Thus far, I'm not doing that power. But as a member, as a stakeholder and recognizing the value of this bill to the country, I would urge those who have the power so to do, to consider that those who understand this bill, and this bill is so critical to the forward movement read this pandemic, need, in other words, Floyd Morris have a thing which says, nothing about us without us. We are of the view, well, certainly I am of it, but that can't be said of you, and you are deserving of anything.
Here.
Yes, sir.
I fully endorse what the member Brown has said.
Yes, all right. Yes, Mrs. Benny Campbell? Yes.
Minister, our records reveal that we did consult with the Ministry of Health and they gave comments, but I can't speak to the nature of the comments, so I'd have to go and look back. But our records reveal, because we had given a report to this Joint Select Committee already, so we had consulted with the Ministry of Health.
So they did give comments. No.
Mr. Chairman,
Yes.
if I may suggest, it's not a difficult problem to solve if there's desire for a resolution. In terms of with Senator Brown's mention of other ministries, Ministry of Agriculture, etc., health relates to this bill more basally than those, education included. Because all of those relate, it's in the context of health that they would want to relate to this bill. So I think it is imperative that we could reach out to the ministry and ask someone to be temporarily appointed or join in, etc. If it's even to be in the deliberations. It is my simple request, and I just want to make sure it is recorded that me as a medical practitioner sitting here is making that request. It can be recognized or not, but I'm establishing that I think it can be executed.
Members, I believe what Member Longmore has put before us is that we invite a representative from the Ministry of Health to join these proceedings. But
I was looking at maybe page 5 of the handout. That person from the labor, industry and commerce, which you just spoke about, and also a person from the Ministry of Health, nominated an attorney at law, and persons from occupational safety and health, also finance, accounts, and audit. I don't know if that would be, you know,
that's moving
that
forward.
Actually,
but that underscores my point actually, because of the level of how important. Yeah, that's after. I'm talking about this process that we're going through now, and this underscores the importance of having said person, because you're going to be having a person appointed to be deliberating on those matters, and we don't have somebody like that represented here now.
yes, well, members, yes. So am I hearing that we are going to take on the suggestion as put forward by Member Longmore? Yes. So we will invite the Ministry of Health and Wellness to join these proceedings. COVID-free. Yes. So the letter will be dispatched forthwith, inviting the Health and Wellness Ministry to participate.
Can we, because you see, we keep sending these letters, yeah? But we can make a telephone call too?
Certainly.
Because we keep sending letters and people don't respond to letters, or they take long to respond to letters. And I know that's a formal, structured way in terms of protocol, but make a telephone call to them, man.
I tell you something, a quick resolution, just a suggestion for whoever may be thinking. The MAJ, there are many retired physicians. It could actually just be communicated that someone could volunteer, you know. Somebody who is retired, somebody, I don't know, it could be just that you have that level of input, an opinion, etc. I don't know if whatever mechanisms, but it's not a hard issue to solve. Many physicians would welcome the opportunity to be able to help contribute in this way.
So we will dispatch the letter to the Ministry of Health and Wellness. Certainly when the committee gives instruction, we assume that the formal process has to be followed, but notwithstanding, the full calls will follow. It is now 24 minutes past 12. Member Skeffrey, you.
Just a quick one, back on the whole 8 and 9 education. I know initially when we were discussing the training and the public education, the issue about the curriculum and the training manuals and so on would be developed by the ministry. Since we are not going to the authority, would that be one such function of the authority now? Because we said to promote and so on, and the certifying of technical examiners. But to develop the curriculum, the material, and the whole modus operandi in terms of training, is this one such role of the authority? No, 9, but 9 is to promote and support. But it didn't talk about develop. I can promote and support something, but I don't have to develop it. So who will develop that curriculum, the training manual, and the whole logistics to lead to certification?
Mr. Mohan, yes?
Yes, so on a previous sitting we had mentioned about the training and the nationwide network and certification of entities that would be able to deliver this training. And we had mentioned entities just like the Hard Trust NTA, which has a extensive reach. So it is really in terms of the curriculum, because we had looked at it to say that it is not necessarily at the level of a postgraduate or so degree, but even short 2-day courses in occupational safety and health, we just give them the guidelines as to what are the elements, and then they would make the submissions and it would be reviewed by the authority.
So the ministry will give them the guideline?
Yeah, the authority. We would give them that if we are going to be having a course, say, on accident prevention, that these are the elements that are important to delivering this course.
But it's one such thing, but the actual content, methodology, and whole assessment is critical if you for effectiveness of the certification.
Yes, and that is some of the criteria that will be used to judge what is submitted by these organizations to certify them. So kind of going back to the whole, it's somewhat related to what Member Brownberg was asking about certifications in terms of the technical examiners and occupational safety and health experts, but it did not really mention about the certification of these institutions that would be delivering the training.
Yeah, but you see, Mr. Chair, where I want to go, because we're going down one road in terms of the ministry leading, and they said, I remember one time said there's a technical team, I remember that's a question, did the ministry that could do all of this? What I'm seeing here now is basically a shift of probably all the responsibility for this bill now going to rest in this authority.
Yes, so it's not the director, it's the authority will be responsible for doing this.
Yeah, but so will the authority be so empowered and will have the capacity to deal with certification in all its facets? Because if we're talking about independence,
yes,
then if you say I have the role to certify, what does the role to certify means? So the conducting, the training, and all those things. Is it that I just sign the certificate and say yes, I've certified you? But who will actually do the legwork?
There is
to ensure that the workplace, the safety and health representative is so certified to carry out the job description in accordance with our expectation in a free and fair manner with the highest level of integrity. So I want to have some more understanding as to the policy that will drive the authority to carry out this work, So when we see the exact provisions in the new provisions in the proposed bill, then we can agree. But so just to say you have the role to certify. Certification is a wide field. And its certification doesn't start with giving a certificate. It starts with the actual production of it ends there. And probably that's the more fanfare aspect. But that's the least of the work. And you have to ensure you have your checks and balances, your proper objectives and all those things. And you have your standard for certification across all workplace. And so if this authority is going to take on this role, no, I'm not saying your heart was partnered with the ministry. But what I'm getting now is that the ministry probably really divorcing itself from the implementation of this bill. Generally, that's my general understanding. Not totally, But you spoke about independence and giving these functions. But it didn't clear about the training and the development of the material. So is it that they're going to be a partnership now with HEART and the new authority? And what role will the ministry still have in the end overall process? I'm not clear as to how we proceed.
So in essence, what is required then is that we will put together a document that kind of spells out some more in terms of that which is speak for the education and training, so that you will get more clarity in terms of the mechanisms and procedures that would be utilized by the authority to do the certification process. In terms of what Member Roenberg had asked for clarity, I know that in the definition clause 4, we had give the definition of what is deemed as an occupational safety and health expert, which is really somebody who gives managerial direction to occupational safety and health programs. And it says, and is so certified by the director, but that would have been the authority. So what we are saying is that these persons would be assisting, even as part of the occupational health services or otherwise, to have these PCBUs or entities develop what we call an occupational safety and health program. So the program is really the whole system of joint responsibility in the entity, the worker representatives, the trade unions, the employers working together in the whole business of the identification of the hazards and the appropriate prevention and control measures that should be put in place. We also speak to want to direct it to the definition of the technical examiners as well, because in these workplaces we'll be using equipment that would require some level of independent testing. If you draw a parallel, if you have your car, you will carry it and do your regular servicing, but you have to have an independent authority that does the fitness at the end of the year. So for those persons who will be involved in that examination of, for example, a steam boiler, a air compressor, a crane or a lifting device, these are the persons that we are alluding to in terms of that certification.
No, can I just follow up on this? My understanding of Senator Skeffrey's question is the representatives in the workplace will require certain certification, and that you will have developed the courses. It may be delivered from outsourced agency, Archos, Exed, whoever. But in the functions, it's not clear that that's your duty to develop the curriculum. And then, that's why I understand his question.
Yes,
Yes.
if I could come in, and that's the understanding I have too, and certainly the authority does have a role to play in the development of the curriculum, and I believe that it is just an amendment to the functions.
And that was part of the question that I was asking in terms of the transparency, the independence, and the separation of responsibilities. You have not said anything about the public education part of it, and
Well, I had replied to Senator Skeffrey's suggestion about the education, we had mentioned about to amend the document to include the public education component.
Yes, Member Gill.
Just, it's 12:33, sir. But I just want to ask, just for clarity in my mind, because there are some times when you establish an authority, and there's a particular legislation that governs that authority. So is this where we're going, or is it that the legislation is going to be a part of this one?
Mrs. Seeley Brown, I will just ask, but
I was just asking. So you have the Sugar Industrial Authority, and it has a legislation on its own. So this particular authority, is it that you're going to have established under
within the legislation? Yes. Okay, fine. Yes. Okay, fine.
No, I
yes.
understand that, I
Yes.
just wanted to be clear.
Within, yes. All right, members, it is 34 minutes past 12. Yes.
Just in terms of procedure, we have discussed the policy here. I just want to be clear in terms of we are discussing the policy here today that outline generally the role and functions of the authority.
The authority
to be established. But for us, what is more important is what are the proposed drafts in the bill.
Yes.
So will we get those proposals to specific clauses that we have in the current bill that will amend the clauses as proposed here, so we can review that and make a decent integrated. So I just want to be clear as to how we proceed, because this is a policy, and while we might agree or not, we can give our view, but the broad policy sets the direction.
This policy relates to Part 8 of the bill, which I think covers sections.
No, we didn't conclude it.
It would be, yes. Yes, substantially.
Chairman, there's a part of it, we didn't get there yet, where it
Yes.
talks about impact on the bill, and I'm cautioning that you can't just look at just that provision, those provisions, because we have also, there are a number of comments that we have also made. The impact of the bill is more far-reaching because it is a fundamental change. So it is not just to that part, I would say. And in fact, even the way you're going to amend the bill, it won't be to that part. It would be earlier in the bill that you would establish, give it that, based on that foundation. The authority. It could possibly mean whoever is the executive director. It doesn't mean, though, that it's a simple switch out of terms. Doesn't mean that wherever you say director, you change it to authority. It could also mean the board, because there's also going to be a board, and you're going to have. So I'm just saying that there are the implications. It's a little more nuanced than just saying Part 8.
So, Mr. Chair, hence, thanks for that clarification, and it reinforces even more so my concern. Because we can come to the next sitting of this committee and go through this policy again, and conclude. But is there a work done concurrently to look at the override of all the clauses and to see how it impacts from clause 1 right down? Yes. And making those proposed changes now, because that's what is important to us. Can we go through this policy next meeting? I will say, okay, concern upon 1, 2, 3, and board and everything. I will say, nay. And I will say, but this is not our work.
Yes.
It's how it impacts this now.
Yes.
And it changes from clause 1 to 200 and odd, where possible. And then a supplementary document before us now, and we work together to make the changes. But so if that work is not being done, because that's a critical work.
Yes, I'll invite Mrs. Seeley Brown to comment, because she would be familiar with the process.
Chairman, it's just that we were discussing, because I was discussing with Mrs. Seeley Brown that she should have a further discussion with the Chief Parliamentary Counsel about the approach that was taken with the data protection bill. I'm suggesting that because that bill, there were also quite a number of changes that were made to that bill. And the approach that was taken in the end was that there was a bill with sort of like track changes to an extent, except I don't know if that's even possible with this one. But in the end, there was a new bill. And in the end, the new bill was actually tabled. So by the time it was being debated in the House of Representatives, there were no amendments because that new bill took into account all of the changes that were recommended in the report of the Joint Select Committee.
Yes, you could use your mic, Mrs. Seeley Brown.
It would be, I think it would be it would be more difficult to track change in this case.
But you don't have to track change.
Yeah, but it would have to definitely be a retabling of a
Chair, what I've come to learn, with your permission, is that drafting of bills is a very technical and specific thing. It can't be everybody drafting bills. It has to be those who are expert at this. And it means that we'll have to, once a policy and the direction is given, we have to then give it to those drafting experts. As the SG said, the whole structure of this bill has to go. There shall be a trust, there shall be an authority, such and such, and the rest flows from that. Now, we can't insert the authority around the back of this bill here, because everything now flows from the existence of the authority. Could I ask that we insource this to the CPC?
Well,
I use my words deliberately.
I am not so clear as to what you're asking.
But I'm saying, Chairman,
because the CPC.
Yeah. No, but a follow-up. No, that's a follow-up. But even the proposed changes and the new policies, who will do that work to take here?
Drafters.
Okay.
Drafters.
No, that's what I meant.
Yes.
I don't mean once we agree on all the changes, you will draft for retable in Parliament. But I mean the proposal, not along this policy. Okay.
Chairman, I've always asked who drafted this bill. Never got an answer, don't want an answer today. But it has been obvious to me that it hasn't come from the CPC. And if you want us to go through the other clauses so the CPC can take it and redo it, but it needs the drafters, the technical drafters, to take charge. In other words, when I say in-source, I mean within the government. But at some point, it needs to leave the Ministry of Labor and go elsewhere. And I hope that can be soon.
Well, I mean, it will leave the ministry once our work is finished here, because when we have exhausted the entire bill in terms of our discussions, then it moves to the drafters, and they will incorporate all the amendments and the positions which we would have taken here into this final document. And then we proceed from there. That's my understanding. Yes.
Because the CPC dealt with the Data Protection Act. She was the one who dealt with that act. I'll speak with her, so I'll have more clarity on how she approached, because that had a significant number of amendments too, and then I can probably speak to you better when we meet again as to what the approach is.
Very well.
Chairman, I just want to say, I was going to say frustrated, but I prefer to use the term exhausted from having where 1, 2, 3, 4 of us sit, and former Senator Brownberg used to sit in that place. I'm exhausted from having had to go through so many amendments to bills coming. And the worst thing, Chair, is when it comes back down, all I hear is move to approval of the Senate amendments, as if to say, well, the house has...
It means well done work. You did
No. It means the house has forfeited its right.
No.
Has forfeited its right
To do up there.
to review. So I really want to see this
We
bill
know you work hard.
moving. And Chairman, it's May now, June, and we're going into the holiday.
We're
But
the
again,
1st
I
of
want to
June.
make
We're
an
the
appeal.
1st of June.
1st of June, whoa. Can we, is it possible for us to deliver an independence gift to the people of the country?
Well,
Because
yes.
whatever it takes for us to meet,
yes. Well,
we
that's the
are
first
prepared
step.
to meet.
That's the first step, Member Brown. We have to complete our work here, and the drafters will need time. So that should take us to the next item on the agenda, which is any other business, which under this heading we can set the schedule for the month of June. Yes.
May I just ask, in the clause-by-clause examinations that have been taking place over the period, and corrections, suggestions, and recommendations made, when will we get back those? I just asked you.
Yes, Mrs. Silliman, you can
I just
respond.
asked.
Yes.
I want.
Yes.
No. Pardon?
Mrs. Silliman, please use the mic.
Yes, I'd like to know.
Yeah, we have to complete all that we've done, and there's still some things that we need to go back to. We haven't done the interpretation, the clauses yet, and I was just speaking to, we still have to complete that matrix. So it's only after that time, when we've settled those issues, can any drafting take place. We have to finish the bill in its entirety, and all of the things that we have outstanding in it.
Well, that's one approach.
Yes. So may we... Oh, Mr. One. The floor is yours, sir.
Thank you, Chair. Chair, I'm seeking some clarity on that discussion about the search for an independent arbiter. If the worker says it's not safe and the employer says it's safe, I believe nothing has been decided on that yet.
My understanding, Mr. One, is that the ministry is to come back to this committee with a settled position as to what will happen in those circumstances.
All right. I want to make a suggestion on that matter. The matter of safety and the judgment as to whether something is safe or not safe in the workplace, I believe, is a much less complex decision than, say, the wrongful termination or sexual harassment, which have their panels and their tribunals, etc. I don't believe this needs a tribunal. It is not as complex. And I think a solution such as let the ministry or the authority have a panel of professional safety engineers, and both sides could pick one from each to let that independent safety engineer come in and look at the situation and decide safe or not safe, rather than implementing another panel or tribunal. I just think that's not the way to go, sir. Thank you.
Yes, Mr. One. Members, you have heard what Mr. One has put forward. Any comments? Yes.
Chairman, I don't need to think about it, because I think just looking at the scheme and some of the questions we asked, it was clear the tribunal was not going to survive this new policy direction, and that the proposal of Mr. Wang bears taken into account, which is why, Mr. Wang, the committee insisted and begged and beseeched that the views of the employers be available to us, so that we may ride together in making this bill. And I think it's worth it. It's akin to the point Senator Langmore made about the medical. In other words, what she's saying is, get some quick responders, because I've always dreaded going to the tribunal. Terms of reference. No. This tribunal, not the other one. I love going to the other one.
But this one
I have a great track record at the other one. So what I dreaded this occupational health and safety thing, because the time, and the truth be told, if there's an unsafe environment in the workplace, you really want to get that done in hours, days at the most, and not to go through, well, send brief, get dates, and we stop work for longer than COVID. That could cripple the economy. So I'm with you, and very, very good suggestion. We thank you, and we beg you to come to the next and the next and the next meeting after the next. No, we need to be.
Mr. Chairman, in an effort to also add maybe solutions and to expedite the process, I would just offer an extension of that, where what practically could obtain is that there is an immediate medical recognition of the risk posed of whatever condition it is, and then that initiates Mr. Mahan, some suspension, some recognition. But of course, clearly, this medically driven verification of the risk is by qualified persons. It is by persons who are agreed upon, etc., etc. That now escalates the situation to where there is the more technical confirmation of the situation and the extent of the situation, which is now where it goes to that level of red tape, etc., etc. But in the interim, some response has been made. The person is probably taken away from said risk situation, etc., etc., until a final decision can be, and more confirmed decision can be made, if I may suggest that.
All right, very well, members. I'm sure the ministry has taken note of the suggestions put forward. Can we now move to the schedule for the rest of the month of June? Normally we reserve Mondays for our meetings. So we have here Monday the 8th, the 15th, the 22nd, and the 29th. Those dates are the Mondays for the period of June. Do we agree to another date during the... So we... Okay. Let me ask. And do we go for longer days, or do we start early? Yes. No, I'm just trying to see whether we'll take a lunch break and return. A whole day, yes.
Chairman, it's going to be challenging for me. The carpet here for the whole day is going to be a problem for me, and wearing the mask. I really can't do 10 to 5. It's going to be a challenge. But also we have some other matters that we usually have to do on a Monday, so it's going to be challenging. But I was just asking if we could start from 9:30 to maybe 1. But is that a challenge?
All right. I think for next week we will do our usual 10 to perhaps 1, and then now we see how.
And I mean,
yes.
Chairman, I will try. So, I mean, we could maybe do 1 all day, but for me to commit to
yes, no, we'll start
all day
next
would
week.
be a real challenge.
We'll do another
for me.
10 to 1 next week, and then we see where we go.
And I'd also just wanted to say, if persons see me cough, I don't think it's not COVID, it's just my asthma. Every time I come here, within an hour, I do start coughing.
We understand, and you will be out of here very, very, very shortly.
And Chairman, if I may add, I raised it to Mrs. Cook in the end of the Senate sitting last week that I'm a bit concerned that we're not having temperature checks coming into the Parliament, and the usual measures that you're seeing outside that are ensuring that persons who may be symptomatic, etc., are being recognized. So I think we maybe want to add our voice to that request of the temperature checks and the sanitization practices at the entrances.
Yes. We will, Member Longmore. We will. Members, one other matter. Some time ago, we would have extended an invitation to the Jamaica Gasoline Retailers Association. Coming out of an unfortunate incident in the parish of Manchester, they have not yet provided us with comments on the bill. They have indicated, however, a willingness to appear before the committee once those the review and the comments are made. So I do not know if as a committee we fix a date or we wait until a report is provided. We fix a date thereafter. We would have written to them more than 60 days now. Yes.
Minister, I'm understanding you to be saying that you are seized of the urgency of getting this bill to the floor of the Parliament, and that you have set, with the support of the committee, weekly meetings for the rest of June, and that you're urging other agencies that may be helpful to us, like the Gasoline Retailers Association, like the Ministry of Health, to do what the JEF has done, to come and sit with us, so that as a committee we may sign off on this bill and have it ready, so that the country needs to understand, is what I'm hearing you to be saying, that we are seized with the urgency of now, and we are doing our best to meet the obligations of the country, because this bill sets new arrangement, like the involvement of workers in determining the health situation in the workplace. And as we go back to work today onward, would urge, and this bill, let me put this way, this bill urges the involvement of workers in decisions. So whether it is social distancing, whether it is wearing of masks, whether it is hand sanitization, or PPEs availability, this committee and you as minister is saying time is of the essence, and we are aware of that and intend to fulfill that. That's what I'm hearing you to be saying. I just want to be clear.
Member Brown, we would have been meeting together as a committee for some time now, and the importance and the urgency of a bill of this nature has certainly been brought to the fore, having regards to the recent events of COVID and others. That being said, we recognize that the parliamentary break is not very far away. The committee's work is still ongoing, and the drafters have indicated that they need some time. So as a committee, definitely we want to do as best as we can to ensure that our work is completed in the shortest possible time. So may we now have a motion for the adjournment? Yes. Seconded by Member Cuthbert Flynn. This meeting is now adjourned until Monday, June 8th at 10 a.m. Yes.
The corrupt are getting away too often. Help catch